Yeah. Within a 10 seconds, we will live to the attendance.
Yes, yes.
So, sir, it's 3, 2, 1. Over to you, sir.
Good morning, friends, and welcome to Live Pharma Coalition, a global knowledge and networking platform for pharma professionals. As you all know, every Sunday, 11 o'clock, we go live on YouTube and Facebook, and we invite industry experts across the pharmaceutical industry to talk about various challenges, opportunities in pharmaceutical industry. And today's episode is LPC 168. And this episode, we are going to touch upon a very important aspect of pharmaceuticals, that is about the students who are going to enter into pharmaceutical industry. And what are the scope of higher education in pharmacy? And this, we have very eminent speaker who is going to talk about that. We have Professor Selmani. And Selmani sir is going to talk about what are the opportunities in pharmaceutical education as a BTech, MTech, PhD, and higher education, not only in India, but also abroad. As you all know, India is known as pharmacy capital of the world. Around 70% of the generic drug of the world is being supplied by India. It is a proud thing for us that we have very good manufacturing facilities and very good pharmaceutical setup. That is why we are not only self-reliant in pharmaceutical industry, but also we are able to cater to the world, not only in vaccine, but all across all the medicines. So it is really a wonderful thing that in today's episode, we have got a subject matter expert. So Dr. Selvamani, thank you very much, sir, for accepting our invite and being a part of LPC today. I just request you to give a brief overview. What is the thing you are going to share? An overview of your topic, Dr. Selvamani. Please unmute. Please unmute, sir. Yes.
Very
Vanakkam,
good
sir.
morning. Vanakkam. Very good morning, one and all. Thank you, LPC, for inviting me for today's episode. And it is very nice to be here with you all. And today's topic is about higher education in pharmacy and the avenues and opportunities around us nationally and beyond. And I'm going to give you an overview of pharmacy education from its historical perspective and the Indian perspective and other pharma courses available in India and the opportunities and avenues how to reach out across globally the pharmacy profession and for our career prospects. So this is the broad overview of the today's topic, and a glimpse of avenues for working professionals especially was the last section. So a brief information on these aspects is included here. So that's my overview, sir.
Thank you, sir. Thank you. It is very relevant in today's context, but because pharmacy education is everyone is looking forward for. And the problem is MB, after doing B pharmacy, students are in a dilemma, what to do, where to go. So it will be a golden opportunity for all the students who are on live to learn about what are the career opportunities and how they can build their career. So it is a wonderful time for us. I'll give a brief overview of Dr. P. Selvamani, sir. He has done PhD in pharmaceutical from Jadavpur University. Not only that, M.Pharma from pharmaceutical chemistry from Jadavpur University, and also postgraduate diploma in chemipharmatics. That is from Institute of Chemipharmatics Studies, Noida, UP. Sir has done B Pharma also, and currently he is the professor of Department of Pharmaceutical Technology, Bharati Darshan Institute of Technology, Tiruchirappalli, were a very holy place, and it is great that sir have been lot of experience in pharmaceutical research, a lot of research and doctoral research paper he has published. Some of the things I would like to communicate that he is the recipient of Tamil Nadu Young Scientist Fellowship Award in 2015 and also Young Investigator Award in 2015. that is recognition of research and accomplishment. Not only that, he is also recipient of Active Research Award in 2013 in recognition of research accomplished, awarded by Center of Technology and Department of Chemistry. Sir, thank you very much. It is really a privilege for LPC viewers to interact with you and to get guidance from you. And one of the classmates of Dr. P. Salomani is there with us, our core team member, Mr. Arumugam Arasan, who is the Zonal Sales Manager in Wokat. Arumugam is there. I request Arumugam to share some memories about Dr. P. Salomani. Yes, Arumugam. Vanakkam.
Vanakkam. Thank you for the opportunity by LPC because the topic is a very good topic because as he told after B Pharmacy, whether go to medical representative or production, only few job opportunity people know, sir, when we are studying. But now artificial intelligence, lot of things is coming in the pharma field. As I told, huge opportunity in pharma field. We want a good guidance. So first we approach Salomani. Last 2 months we are trying to Salomani to Dr. Salomani to catch him because he is very busy with guiding his project students, PhD students in Anna University. I am very proud. Salomani introducing, being saying that I am a classmate of Salomani because from the college Ramakrishna's Coimbatore we studied. He is behind our Principal Ravi sir and Sundar Velan sir. Always he is a bright student. From that time onwards, he is a academician. He always carrying book Indian Pharmacopoeia 2019, always in the book in his hand. Only book only he will be having. So I am very proud that he is now in top position Anna University and guiding lot of students. And now he is giving information to the public. What is the job opportunity for the future? Really, I am very proud saying that Salomani is our alumni of Ramakrishna. Thank you very much for the opportunity, sir. Salomani, can these percentages?
Thank you. I will just give a brief overview of LPC to those who are very new to LPC. Thank you very much, Mr. Aramagam Arasan, for giving a brief overview of our speaker today. Welcome to LPC, all the new viewers, a global knowledge and networking forum for pharma professionals. As you all know, we invite leaders from manufacturing, sales and marketing, global packaging, supply chain, academics, and HR and L&D. And this is what is the learning and sharing platform we have geared. And this is the core team of LPC executive team, which is always there to create a learning environment in the pharmaceutical industry. And these are some of the core advisors and mentors who always encourage us to take this challenge, momentum, continue. Some of the Mr. Ganesh Nayak, Executive Director, Zydus, OP Singh, Global CEO, Acums, Mohammad Shahbaz Khan, Alam, that is MD, Shahbaz Pharma, AVPS Chakravarti, sir, Global Ambassador of World Packaging, Dilip Singh Rathod, sir, who is the President of JV Pharma, Ramesh Juneja, sir, Vice President, ex-Vice President, Reliance, Mr. Dr. P.K. Rajput, former Senior Vice President, Domestic International, Cadila, Venugopal Vijayendra, President, Intas Pharma, and Manoj Saxena, sir, head of India and Southeast Asia buyer, and Ashok Bhatia, sir, global CEO, Abacus Pharma. These are the mentors and advisors. This is what we are proud of. We have recently got Pharma Ratna Universe Award 2022 for the longest running webinar in medical and pharmaceutical field. Thank you very much, Pharma Ratna team. These are some of the glimpses of our conclave, LPC 100 conclave in Mumbai, LPC 125 conclave at Ahmedabad, and LPC conclave 3.0 in Navi Mumbai. And then recently, LPC 150 conclave, which happened in National Institute of Pharmaceutical Education Research, Naipur, Hyderabad. And very shortly, as you all know, we are going to come with LPC 175. These are some of the eminent speakers of LPC 150 conclave, Hyderabad. And this is today's topic, higher education in pharmacy, avenues and opportunities. Professor Dr. P. Salomani, sir, and let us go through this. And we are very much thankful to our streaming partner, Imagica Health, for continuous support. Thank you very much, Imagica Health. Now, I request Dr. P. Salvakumar, sir, to give an overview of his presentation on what are the opportunities for the pharmacy students in higher education in India as well as abroad. Thank you very much.
Thank you, sir.
Yes, sir, visible.
Yeah, okay. So very good morning, one and all again. And thanks a lot for LPC team for inviting me here for the today's presentation. So it's about the higher education in pharmacy and avenues and opportunities, as you told earlier. So a small disclaimer statement, because all the information that I have collected from the web and other resources which are prone for changes and updates. So kindly ensure the reliability when you are using this information in future for your particular purposes. And the outline of my talk will be the background of pharmacy education, the establishment of Pharmacy Council of India, so who is the regulatory authority of pharmacy in India, and the education, how they are regulating at various levels, that is at the diploma level, undergraduate, postgraduate, and at the doctorate level, and the avenues and resources for working pharmacy professionals, slightly in detail with various degrees and nomenclatures and so on. So this is the outline, and I may take around 35 to 40 minutes of your time for running through this presentation. So hope any kind of questions that you can address to the team over the text, and it may be answered at the end of the session. And once again, thank you. And let me start that. So this is a statement that I am a pharmacist, and always this is my calling and this is my pride, because we know many things that about medicines, that I am a specialist in medication, I am a companion of the physician, and I am a counselor to the patient, and I am a guardian of public health. So we all have this kind of feel after completing our pharmacy courses at some stages. So in order to enhance this pride, the sense of pride, we need to further continuously learn and update ourselves with the transformation that is happening globally with respect to the disease state, the medical technologies, the other technologies like information technologies, industrial technologies, and so on. So therefore, the pharma education is very, very important in order to save the patients or the humans and the life around us. So always I feel very proud to be a pharmacist, and I'm a continuous learner. And we have our own career prospects in different settings, just as a pharmacist in case of practice, maybe a community pharmacist, hospital or clinical, and various roles in the industry, production, quality assurance, bulk drugs, formulation, R&D, many. And in the other settings, including the teaching and the clinical research, regulation, and academic research. So this is the domain where I am performing. So I perform teaching as well as academic research, that's fundamental research with some small amount of preclinical research. And so in order to serve this diverse career in the umbrella of pharmacist, so we need to learn many things, and we need to constantly update ourselves with the changes that is happening around us. So you could see there are a lot of jobs around us, that is public sector jobs under various terms and designations, and certain private sector jobs, and certain international or interdisciplinary jobs. So all these things will help us to run our pharmacist role in different designations or different terminologies effectively in order to ensure the healthcare of the global population. So here, so again, the list continues. So there are different designations. So as a diet counselor, home health pharmacist, nuclear pharmacist, homeopathic pharmacist, veterinary, pediatric, ambulatory, and we have regulatory scientist, sample assistant, drug information, government analyst, many, and the list is very exhaustive in nature. Anyhow, so the education is prime. So therefore, during the 100th year of International Federation of International Pharmacy, so FIP, so they made an education initiative, and they constituted the Pharmacy Education Task Force And the small statement, narration of the essence of this particular task force is the global pharmacy professional workforce needs to be competent. So this is very important. Competent, adaptable, and oriented to a medicine center, patient-focused approach towards education, development, and professional practice. So in order to be competent, we need to learn the fundamentals, the developed things, the developments that has happened, and the advances and the future updations. So then only we can become highly competent in a particular arena. So no one can do the entire thing or the entire subjects competent. So at least we need to take certain roles or certain domains, and we need to update ourselves in order to be competent. And also the other attributes like adaptability, orientation, medicine center, and patient focused, all these things are possible through a rigorous education, development, as well as practice. Practice includes the continuous training, practical training, lifelong education, professional development courses, certificate courses, many things. So the essence says the education is very, very important. And they told the needs to be identified. It may be local or regional, national, and international, and the services need to be met these needs. And we need to develop competencies, and these competencies can be acquired only through education. So this was the vision of FIP, and based on which the global pharmaceutical curriculum development is happening nowadays. So coming to the India, the pharmacy was originated, or it can be said that it is as old as human civilization. So there is no such document that pharmacy originated this date, month, year, like that. So whenever the medicine was originated, the pharmacy is also originated simultaneously and parallelly. And the earlier history says all the physicians, the old physicians, they developed the pharmacy profession along with their practice. And the physician and the pharmacy, it was no longer a separate profession in the olden days or the historical days. Later on, it happened that there should be a separation. There need to be a separation. In the 12th century, it has happened. The pharmacy profession was splitted out from the medical profession because it requires certain skills and a skill set, and the services are diverse. So they need to be a separate profession. They recognize that, and the physicians were separated and the pharmacists were separated in the 12th century. And coming to India, the pharmacy education was started as a certificate program by a Portuguese company in Goa, and it is a certificate program that time. It is in the 1852, and later on, the pharmacy was developed in Benares Hindu University as a full-time course by Professor M.L. Shroff in the year 1937. And then the government of India has recognized the need of the establishment of Pharmacy Council of India, and they enacted the Pharmacy Act in 1948. So the Pharmacy Act 1948 regulates the pharmacy education and practice in India. And it enforces standards, it accreditates, it recognizes, and it conducts inspections and assessments, and so on. And also, the council registers and regulates the pharmacists by maintaining a central register of qualified pharmacists, and they issue guidelines, regulations related to the professional conduct and professional ethics, and it promotes continuing education and professional development for pharmacists. And they are responsible for approving and monitoring the pharmacy education program at various levels, at diploma level, undergraduate, postgraduate, and doctoral program. And the council plays a central role in shaping the pharmacy profession in India. So then these are the various courses regulated by Pharmacy Council of India. So the earliest education program for a pharmacist approved by Pharmacy Council of India was Diploma in Pharmacy, and it was regulated by the regulations 1991, Education Regulations 1991. and subsequent amendments in 1994, 96, and 2014. Thereafter, the curriculum of DPharm was highly updated, and the education regulations was totally revised in the year 2020. So currently, we are following the DPharm Education Regulations 2020. The second degree is Pharm D, so that is Doctor of Pharmacy. So there are two things, that is Pharm D and Pharm D Post-Baccalaureate. So Pharm D is a 6 years duration program, and it is governed by PCA Education Regulations 2008. And after BPharm also one can perform the Pharm D program. So that is for 3 years duration, which includes 1 year of training. So therefore, Pharm D is a very important program with the recent development, that is from 2008. India is practicing this. And there is another thing, BPharm, and that is exclusively for clinical setting. They call pharmacy practice, Bachelor of Pharmacy practice. So it was enacted by the regulations 2014 by PCA, and it is available in India. And the most popular education for pharmacy is BPharm, that is Bachelor of Pharmacy, and it is enacted by the PCA course regulations 2014. Also, the Master of Pharmacy course regulations 2014. So all the eligibility for becoming a student to get enrolled in a specific course, the course of study, the duration, the examination pattern, the assessment pattern, everything is prescribed here in the regulations. Up to 2008, only DPharm was regulated by Pharmacy Council of India. And later on, that Pharmacy Council has included the Bachelor of Pharmacy as well as Master of Pharmacy as one of the courses, educational avenues of to become a pharmacist. And it is approved by the Ministry and the Government of India in the year 2014. And Pharm D was enacted and approved by the government in the year 2008. So earlier, only DPharm is eligible, or that is the only course to become officially a pharmacist in India. So now we have all these avenues, DPharm, Pharm D, BPharm, and MPharm. And if you have completed any of the degrees in a PCA recognized institute, then you may be register yourself as a pharmacist in any of the state council. So there are few other courses in the diploma level. The diploma in pharmacy is recognized by PCA, but there are certain universities and institutes, they are offering diploma program in other names, that is Diploma in Pharmaceutical Sciences, Pharmacy Practice, Industrial Pharmacy, Pharmaceutical Chemistry, Pharmaceutical Quality Assurance, Pharmacovigilance, and so on. But the nomenclature approved by PCA is Diploma in Pharmacy. But there are other institutes who have the status of awarding degree under the UGC and other government regulations. They are awarding these degrees too at the diploma level. Coming to the undergraduate degree level, in India, the three things are approved by PCI. So the Bachelor of Pharmacy, BPharm Pharmacy Practice, and the Bachelor of Pharmaceutical Sciences. So these three things are officially recognized by the Pharmacy Council of India, and other nomenclatures like B-Pharmacy in Pharmaceutical Technology, Pharmaceutical Management, Pharmaceutical Chemistry, Cognitive, Ecology, Ayurvedic Pharmacy, everything is there by other institutes. And coming to the undergraduate degree courses, one of the IIT, that is IIT BHU, is offering Bachelor of Technology in Pharmaceutical Technology, that is BTech degree in Pharmaceutical Technology. And University of Calcutta is also offering, Anna University is offering, and Institute of Chemical Technology Mumbai is offering, and many other private deemed universities and other self-financing institutes, they are also offering nowadays the BTech in Pharmaceutical Technology, which is not under the purview of Pharmacy Council of India, and those graduates were no more called or eligible as a pharmacist. They are not clinical also. They are all focused for the industrial services, pharmaceutical services at the industry level. And the other course is Bachelor of Technology in Chemical Sciences and Technology with specialized in pharmacy, specialized in petroleum, pharmacy, textile, printing, many things are there. So this particular course is having many specialization, and it also offers a specialization in pharmaceutical technology. So these are the two different BTech courses in pharmaceutical technology available in India. And coming to abroad, the terminologies differ. They are Bachelor of Science in Pharmaceutical Sciences, Bachelor of Technology in Pharmaceutical Technology, Bachelor of Science in Pharmaceutical Engineering, Bachelor of Pharmacy. So many terminologies were used in many different countries. And apart from BPharm, the graduate can enroll for a degree in law through a distance education mode. So this slide I have prepared for working professionals. Once they have completed their diploma or B.Pharmacy, then they may undergo this bachelor degree or master's degree in law as per their requirement and eligibility through a distance education mode, so that they can perform the pharmaceutical regulatory profession with this eligibility. So these are the 4 common universities available in India, and there are other universities and institutes in abroad. University of London, UK. So they are also offering LLB degree through distance learning. University of South Africa, Open University, Edinburgh University, Northumbria University. Everyone is offering the law program for distance education. So as I told you, it is distance learning mode because it is prepared for the working professionals. And there are specializations too in the law discipline, that is intellectual property law, to become a patent, life science patent attorney, patent lawyer, and health law, regulatory law, and pharmaceutical law, food and drug law, compliance and ethics. So these are few of the specializations in the law profession that can be utilized for your career prospects. So coming to the next level of education, that is postgraduate degree courses, the Master of Pharmacy. So it is approved by the Pharmacy Council of India. And there are a lot of specializations in Master of Pharmacy, which I have given here: clinical pharmacy, pharmaceutical management, cognosy, analysis, industrial pharmacy, pharmaceutical engineering, pharmaceutical technology, zootechnology, chemistry, and so on. So this is the approved nomenclature, M.Pharm, Master of Pharmacy, governed by the Pharmacy Council of India. And there are other courses at the master's level, that is Master of Science in Pharmaceutical Sciences, that is MSc Pharma, and MSc Pharmaceutical Chemistry. They are also offered by certain universities in India. And MS degrees are exclusively offered by NIPERS, spread across India, and MS by research offered by Anna University. And there are MTech courses with specializations in pharmaceutical technology, biopharmaceutical technology, pharmaceutical biotechnology, biotechnology, life science, biomedical engineering, biomedical technology. So the list is long, and we can perform MBA too along for our management perspectives. So these are all the various postgraduate degree courses available for a pharmacy graduate. And newer specializations in MBA includes the hospital and health management, pharmaceutical management, and development management. So these are all industry-focused MBA programs recently available in India. And the next level of program is doctoral program. The common terminology is Doctor of Pharmacy, that is PharmD. So that is governed by a Pharmacy Council of India. And the Doctor of Philosophy in Pharmacy, that is PhD in Pharmacy, and Doctor of Philosophy in Pharmaceutical Sciences, Pharmaceutical Chemistry, Pharmacology, and the specialization list extends. These are all very common, but it is not governed by Pharmacy Council of India. It is governed by the UGC or AICTE regulations, predominantly UGC. The UGC gives guidelines for the Doctor of Philosophy education throughout India. So we all follow the UGC guidelines, and it is not under the purview of Pharmacy Council of India. And previously, the pharmacy education was regulated by 2 agencies. One is Pharmacy Council of India, the other one is AICTE, All India Council for Technical Education. But nowadays, AICTE has given or given up the regulatory role of pharmacy curriculum or pharmacy education in India. And now the PCI is the sole authority for regulating the pharmacy education in India. So these are the various levels. So certain dual degree programs are available. So like BPharm plus MBA. So usually MBA is 2 years, BPharm is 4 years, totally 6 years. But this dual degree gives a chance to the students to save 1 academic year. So it is a 5-year program, dual degree program in an institute here. And there are other institutes also offering such dual degree program or integrated programs at various levels similarly. So when you want to select an institute, the order of merit goes like this. So conventionally, the IITs are the best in under the MHRD is considered as one of the best institutes in India. So IITs, IISc, followed by NITs, and then followed by central universities, and then followed by state universities. Similarly, the national laboratories supported by central funding agencies like CSIR, DBT, ICMR, and so on. And other several deemed universities are also equally important and so very good in nature to offer pharmacy education. So the list here, what I have shown here, the pharmacy course is available, only one IIT is available, that is IIT BHU. And there are a few central universities out of 56 central universities, pharmacy education is available. And many state universities, which include a technical university, medical university, and some are arts and science universities. And almost all laboratories under CSIR, DBT, ICMR, directly or indirectly supporting the pharma research. And then there are several deemed universities. So you can opt any one of the institution as per your interest and eligibility so that you can avail of higher pharmacy education at either from diploma or UG, PG and doctoral level. Okay, to study higher education in pharmacy, and there are certain scholarships and fellowships available abroad. So the American Association of Colleges of Pharmacy Student Scholarship Program. So they provide scholarship for pharmacy students for UG, PG degrees. But the condition is it should be in the accredited pharmacy schools in the United States. The other one is National Association of Chain Drugstores Foundation Scholarship, American Foundation for Pharmaceutical Education, Commonwealth Scholarship, Fulbright Scholarship. So all these things will help any of us to do our PG or doctoral degree in pharmacy in any of their states, for instance. Similarly, Gates, Cambridge, Rhodes Scholarship, European Federation, Novartis, Canadian Institutes of Health Research, all these things are also supporting for higher education in pharmacy, both teaching as, PG level and doctoral research level. And government scholarships and fellowships are also available and provided by AICTE, Indian Council for Medical Research, University Grants Commission, Department of Science and Technology to students to pursue their UG and PG degree based on certain eligibility criteria, that the qualification of GPAT or GATE degrees. And the government scholarships and fellowships under the name of Prime Minister Scholarship Scheme and National Handicapped Finance Development Corporation is also available for pursuing UG as well as PG courses in pharmacy. Certain private scholarship by non-governmental organizations like Dr. Manmohan Singh Scholarship, Narottam Sekasaria Foundation Scholarship, J.N. Tata Endowment Scholarship, O.P. Jindal Pharma Scholarship by Indian Pharmaceutical Association, Biocon KGA Fellowship are also available for all our students at both at UG and PG and doctoral level of pharmacy education. So since I am from Tamil Nadu, our own government, Tamil Nadu government is giving education scholarship for pursuing UG, PG education. It is based on communal scholarship also, post-matric scholarship, educational trust scholarship, minority scholarship. All these different scholarships are also available for our own students here to pursue their higher education. And in order to get admission into higher degrees, usually we need to undergo the competitive exams like GPAT nowadays and earlier GATE. So both the things are very mandatory to gain admission in reputed institutes with scholarships or fellowships. And there are state level entrance examinations organized nowadays by various state governments and the regional universities there. And pharmacy students can enroll themselves in such entrance examinations, and based on the merit and reservation policies, they can get admitted into their PG degree programs or doctoral degree programs. And as such pharmacy course in India, it is not available in the distance education mode. So any UG or PG degree, if somebody is giving a notification that it is offered under distance education, it is not approved by Government of India and it is not valid. So we need to enroll ourselves for UG, PG in direct mode only, that is regular mode. So for selecting the institutes, if you want to go globally, you want to have your career abroad, and if you want to select an institute, and you should ensure that that particular institute is whether it is accredited by the Accreditation Council for Pharmacy Education. So this Accreditation Council for Pharmacy Education, if it was approved by them, then your degree is valid globally. You need not have your additional examinations or additional qualifying examinations or screening examinations for any career prospects. Suppose if your institute is not approved by this Accreditation Council for Pharmacy Education, then you may need to undergo such qualifying or screening tests for your higher education, for your career and other things. So the highest order of pharmacy institute should be ranked on the basis of accreditation by Accreditation Council for Pharmacy Education. So if not, so this is an international recognition, and in India, a National Board of Accreditation is available, and NIR of ranking is available for ranking the institution, and World University ranking is available. National Assessment and Accreditation Council is available. So these kind of metrics you need to verify before seeking admission in any of the pharma institutes. So this will give you a recognition for your degree and for the course that what you have done, because it is globally accredited. Accredited means standardized, it is regulated. Then there are a lot of professional avenues available for the working professionals. So initially, when we are students, naturally the students, after completing our degree, then we will seek some employment and we will go as a sales representative in order to earn. But later on, we may recognize that we may need to do some kind of education for our career elevation or better career prospects like that. But that may be okay initially, but after gaining the work experience, we need to develop certain regulatory knowledge. We need to pursue certain professional certification courses, and we can become a quality auditor, certified quality auditor, GMP auditor, and all these things are available with professional associations mentioned here, and ISO auditor. So all these things will give you a kind of additional recognitions in addition to a pharmacist role and as well as a sales personal role. And this continual professional development helps us to engage ourselves and to update ourselves with industry trends, best practices, and the regulatory updates. And we may pursue some advanced education. So there are certain degree programs, say for example, MS by research, it is a part-time mode, is also available. PhD research, doctoral research is available on regular as well as part-time mode. So like that, if you are interested, then you may pursue some advanced education, which is not mandatory, but may enhance your prospects in a better way. And there are several institutes in India as well as abroad, and we can build a network, and that will help you to grow yourself by getting some mentorships or some insights from others, and also the job avenues. And a lot of audit experience can be gained, and when we are visiting the others or when we are participating in internal audits or assisting in external audit. And by keeping updating ourselves, apart from sales, we can become a certified auditor at various levels, FDA, ISO, GMP, quality auditor, both for academic as well as industrial setups. So this is one such association, that is International Society for Pharmaceutical Engineering. So they offer a lot of conferences as well as training program. By becoming a member, we can pursue a lot of training programs here, and it is for industries, exclusively for pharma industries. So after doing this, after getting it trained and after certified by ISPE, you may have a very good job prospects at the industry level in various setup like supply chain, regulatory, quality, product development, management, facilities, information, and so on. So very good professional organization. The other one is the Institute of Good Manufacturing Practices in India, so which is autonomous body recognized by Ministry of Commerce and Industry and Government of India. Here also you can see that admission for PG diploma and professional certification for various pharma courses like nutraceutical, clinical data, regulatory affairs, medical devices, quality assurance, and quality control. So more than 50 different certificate courses are available under this particular category. So very good, and government institution too. And you can get the government approved certificate in order to increase your career prospects. And there is a site called Coursera, which offers a variety of courses for businesses, for universities, for government, for individuals. And almost everything is online under this thing. So if you can enroll, and it is partnered with various universities globally. So you can choose a degree and you can choose which university you want to get a degree abroad. So all these things can be done online. So it is an online degree program. So here a lot of courses are available. So for individuals and for businesses. So if you want to make businesses, then it can be also wonderful. Pharma business, biotech business, and so on like that. And a huge number of literatures and books are available, offered by various professional associations, how to perform marketing. And so when we go through all these things, the career prospect avenues can be improved a lot. It's not a simple book, it's a very really good book. And there are certain gadgets, means IT tools that is available nowadays for working professionals to make them smart. And this program, that is Smart Pharmacist program, so it's a learning platform which is available, and it is sustainable, evidence-based educational initiative designed by national professional institutions, associations, and chambers to foster changes in the pharmacy profession. So a lot of avenues are available in this site. So one can enroll here in this Smart Pharmacist for higher learning, and which can be applied tomorrow for your career elevations. So this is American Pharmacist Association. So they are doing a wonderful job. So here there is a tab education and career, conferences, practices, publications, and so on. So once becoming a member, we can get the benefits of all these membership benefits under all these avenues. And the education, one of the priority of the American Pharmacist Association. So we can educate our patients too with the help of patient teaching aid in the US Pharmacist site. And we can learn ourselves with the help of videos and health awareness, disease state, pharmacy practice. Everything is being reported here. So we can go through the things, and we can access the magazines, and we can access the art. So this is another portal for the healthcare sales and marketing, and it's a network. Probably you may know, but it's something new for me. But anyhow, the Academy of Applied Pharmaceutical Sciences. So they are organizing these things, Academy of Applied Pharmaceutical Sciences from Canada. So it's highly useful for the pharmacist profession, for the certification, industry link, marketing resources, everything is available as an app. So we can gather a lot of information on the medical sales and marketing. So this is another site, pharmamarketing.com. So here also you can post all your products, and you can reach out the world and the total medical community for your sales and marketing. So by which also you can enhance your targets. So there is one more thing called Medical Affairs Professional Society. So it's a very important organization that is not for profit. Many medical members were enrolled here as members, and the community organizes many events. They partners. There are a lot of events are conducted here. So the latest things are being educated to the members of this association. So this is an exclusive site for medical representatives, where a lot of certifications for pharma sales career is given here. So once after becoming a member, we can join the course, and they will train you, they will certify you, and this certification will help you to enhance your pharma sales career. And the other site is from New Hampshire, that is professional licensure and certification. So every country or every state, they have their own regulatory authority. So this is one particular site. As an example, I am showing here. So we can undergo these examinations given here, and after getting training or after learning the rules and regulations, and to gain a license to practice the profession. So this can be done online also. So once after becoming eligible, means the certified pharmacy technician, we may travel to the particular country to perform some profession at various levels. So means for distribution, bulk, sterile, manufacturing, pharmacy technician, wholesale, anything is possible. So a lot of licenses are available here, and the corresponding applications are also available here. So like that, many sites are there for each and every state and country. So we need to look into that, and we can apply, and we can educate ourselves as a continuous learning, either through a distance education or online mode, and then we can elevate ourselves with appropriate career prospects. So this is a marketing management site. So for pharma professionals, sales professionals. So medical devices marketing management is possible online. So they have a lot of databases, platforms, and services. Markets can be analyzed, resources can be analyzed. So to become a member, we have to enroll, and then we can have a very good relationship with the physicians and increase their engagement and to improve the marketing strategies. So we all know that it's a digital era, and artificial intelligence is playing a wide role nowadays. It is started making an application nowadays. Everywhere we could able to see, since from the browser itself, there are AI gadgets, and for text, grammar, everything. A lot of artificial intelligence tools are there nowadays for us to enhance our work capability. And like that, for commercialization, that is for marketing also, we have softwares and tools available here. So many industries. So this Accenture is very leading. You all know that they have a lot of services for commercialization, and various types of industries are already enrolled, and we can train here. We can take training, and we can enhance our careers also. So modernizing commercial practices has gained top biopharma and added 1 billion in revenue in recent times. So this is the thing they are claiming. So we have a lot of tools for this particular thing: digital health, reinventing the enterprise operations, generative AI technology in business. Together we can have data collaborations. So this is the site from Accenture, the page from Accenture website. Artificial intelligence is making a strong footprint in pharma and biopharma industries. There are other artificial intelligence tools that like natural language processing tool, predictive analysis platform, virtual assistant and chatbots, and recommendation engines, image recognition and analysis, social media listening and monitoring, data analytics platform. Everything is powered by AI, and all these things definitely is going to make a serious change and tremendous change towards profitability, perfection, and other things. So AI is very important. And coming to the certification, we can approach the leading professional organizations abroad like the American Pharmacist Association and American Society of Health System Pharmacist, National Community Pharmacist Association, Pharmaceutical Research and Manufacturers of America. And in India, there are several pharmaceutical associations already. They are offering various training programs and events and courses. So we can choose any one of them either in India or abroad for our improvement. So this is a recent paper published in July 2023, very recently. So the specialized competency framework for pharmacists in managerial positions in sales and marketing, development, validation, and correlates. So they made excellent research for the pharmacists who are there in the managerial positions in sales and marketing. So how their higher education is helping them, they have correlated. So this is happened, this research is performed in Lebanon. The research shows, so this is with respect to the highest academic degree versus low. The blue is highest academic degree and the green is lowest academic degree. For example, doctorate and diploma. So highest and lowest, and on across various domains like professional communication, organization and management, professional practice, personal practice, upper management, preparedness and response to emergency. Definitely the higher education in certain places are not making significant difference in this particular research, but over the period of experience together with the higher education, it makes something significant. So 17 years of experience and more on various domains, it is on the top or equivalent. So here, what they recommend is certifications are common and highly recommended, but not required. But register for certification exams online, and many professionals in this occupation choose certified professional manufacturer representative or certified sales professional certification offered by the Manufacturers Representatives Educational Research Foundation, and the CNPR certification offered by the National Association of Pharmaceutical Sales Representative, and the training program that equips participants in-depth knowledge of both sales and pharmaceutical medications. We may not be able to pursue a full-time education in higher degree, say at a postgraduate level or a doctorate level, but at least we may be able to spare some time to undergo this kind of certification program. And this certification program definitely enhances the career prospects of sales professionals. So to summarize, pharmacists earlier were dominating in the primary care. Now the transformation happens to a specialty care, say for example, nuclear pharmacy, veterinary pharmacy, pediatric pharmacy, neuro pharmacy. So specialty pharmacists were there. Now with the advent of digital health, so we need to undergo the digital transformation. We need to update ourselves for the digital transformation. We need to able to develop and standardize, calibrate, handle, evaluate digital health tools, medical devices, and the forthcoming future generation will have a data analysis. Huge volume of data, big data is available before us, the clinical, the preclinical, the research, the fundamental research, the academic, the non-standard data at various classifications and various populations, regions, domains. So the data analysis is a very big issue to perform manually, and we need to take help of the digital health, digital tools for population health analytics, and the pharmacist should or must educate or elevate themselves or himself or herself for this population health analytics, so that we can survive the future And this is possible only by lifelong learning. And there are few quotes: without education, there is no future, and a develop passion for learning. If you do so, you will never cease to grow. And continuous learning is the minimum requirement for success in any field. So based on these quotes, I urge the audience of LPC and for a lifelong learning in a reputed pharma institute and accreditation and this kind of online mode, distance education mode, part-time mode, dual mode, many attributes are available for you. So you have to carefully choose which one will be more suitable and more prospective for you. And we at Anna University offer BTech and MTech, MS degree and doctoral degree. And if any one of you are interested, and we are ready to help you, we have very good infrastructure and we have a very good research and academic setup. So I invite anyone to make use of the resources if you are interested. So I'm happy to answer you some questions if any, and you can always reach out me at my email and mobile for any clarifications. So thank you, sir. Thank you, audience.
Thank you, sir. Thank you very much, sir. It was a wonderful session, we can say, very comprehensive. Although some brief knowledge about pharmacy, B Pharma and M Pharma, I and Arumugam, we both were having, but so much of opportunities across the world for pharmacy, first time we saw. Thank you very much once again, Dr. P. Selvamani, sir, for enlightening us about the world of pharma. And coincidentally, I and Arumugam and all our viewers, we have been there in pharma for 25 years.
Yeah.
I am there for more than 26 years. It was first time in my career I came to know about so much opportunities for pharma people. So once again, thank you very much, sir. It was a wonderful learning and listening to you. All our viewers are also very happy and appreciated. Before going to viewers and questions, I would like to quickly, it is very difficult for me to recap all the things you have shared. But I will just learning points, key learning points I would like to reiterate. Take home message for our viewers. You started with a wonderful sentence called pharmacy. Pharmacist is the expert in medicine. He is the companion of healthcare practitioner, companion of patient, and companion of public health. Not only that, you talked about Pharmacy Council of India, which offers D Pharm, Pharm D, B Pharm, and M Pharm courses, which are highly recognized courses. And then you have talked about Diploma in Pharmacy for undergraduate courses like Diploma in Pharmaceutical Science, Pharmacy Practices, Diploma in Industrial Pharmacy, and B Pharma, Pharma Practice, BTech Pharma, Technology, and particularly this is a new learning for our viewers, where people can do BTech Pharma, which is a new, which is again having a lot of scope, and in the industrial, in pharmaceutical industries, and BTech Pharma, Pharmaceutical Technology. This course is being offered by Nars University, BHU, Anna University, Tiruchirappalli, BIT, and Jadavpur University mainly. And then you talked about some of the abroad courses of abroad, BSc Pharmaceutical Technology. And you also talked about LLB courses also, law courses in pharmaceuticals, intellectual property law, food and drug law, compliance law. And not only that, you talked about postgraduate degree, M Pharma in pharmaceutics, M Pharma in pharmaceutical science, M Pharma in pharmacognosy. And not only that, there is another institute in India, National Institute of Pharmaceutical Education and Research, which offers MS degree in pharmaceutical science and pharmaceutics. MSc, MBA, and MTech are also there for professional courses. And now there are some more newer courses are coming: hospital and health management, pharmaceutical management, doctoral degree you talked about, Pharm D and PhD, which are governed by UGC. That is what is another opportunity. Those who are after doing M Pharma or MS in pharmaceutical, those who are interested to do higher education, they can opt for PhD or PharmD courses under recognition of UGC. Not only that, you talked about lot of scholarship which are available, international scholarship and national scholarship for those patients who want some educational assistance, financial assistance for their higher educations. AACP, GATES, AICET, ICMR, right? PM scholarship are there, which are government recognized, and some of the private institute also offer scholarship like Dr. Manmohan Singh scholarship, Biocon scholarship, Tamil Nadu higher education scholarship. So there are immense opportunity for those who want to build their career in pharmaceuticals, and finance is not a constraint for right deserving candidates. There are a lot of financial scholarship assistance available. So for the admission is concerned for a higher education, you talked about GPAT, entrance test, CET, JEE, and all these. There is no distance learning. These all are regular courses that you offer. Thank you very much for that, sir. And global accreditation also you talked about, Council of Pharmaceutical Education, ACPE. That is what American Accreditation Council of Pharmaceutical Education gives accreditation. So before enrolling for any higher education, we should check whether this institute and the course is accredited or not. Validity of the course we can check. Not only that, some professional avenues are there you talked about where we can get educational, that is ISP, International Society of Pharmaceutical Education, IGMPI, Institute of Good Manufacturing Practices of India. These are two of the very good valid organizations where people who are in various level in pharmaceuticals can enroll and get some certificate course and short-term and long-term diploma course which will build their career further. Right? Coursera also is an online digital course which offers a lot of courses. Some of the courses are free of cost also on pharmaceutical education. Thank you very much, sir. This is what we learned a lot from you. We are really mesmerized to see the learning. Thank you very much. And I would like to, now I request you to close this presentation, sir, so that we all will be visible. Yes. So thank you very much. I would like to now recognize our viewers who have been continuous and appreciating our this information, depth of information. Pankaj Srivastav sir, who is a core team member, he is watching. Bharat Solanki sir, who is the MD of BIOS lab, he is watching from Rajkot. Thank you very much, Bharat sir, for appreciating Pankaj Srivastav sir. Arumugam ji already there. Ramaswamy Pillai, thank you very much, Ramaswamy. He is a regular viewer of our LPC. Thank you very much. Vipin Dukshit, thank you very much, Vipin, for appreciating the courses. I also agree. Lot of information we got today. Muhammad Sahimsa Muhammad. Thank you very much, Muhammad, for appreciating and sharing your views. We are really thankful to all the viewers who have been appreciating. There are a lot of more. And one of the two questions I would like to go to Sir Selvamani sir. Sir, some of the questions which our viewers are asking very relevant for us. Those like us who have already working in pharmaceutical. For my background, I have done MSc in chemistry. That's all. I have not done any other course in pharmacy. So, but I have 25 years of experience in sales and marketing. So BSc student, science students who are working as an area business manager, journal manager, medical representative, can you suggest some courses which will be helpful for them and which will get them more opportunity to earn, who are not B pharmacy graduate, who are pure BSc graduate or MSc graduate, and but they are in pharmaceutical sales and marketing for 10 years, good knowledge, but no degree. What you can suggest for them?
Yes.
Any idea, sir? Yes.
You have already a postgraduate degree, so therefore you can perform a PhD degree if you are interested. And
Right.
all universities across India, you are eligible for a doctoral degree, provided you have to clear an entrance examination and interview. And this doctoral degree is available in two different modes, regular as well as part-time. Regular mode, you will be getting a fellowship of around 50,000 rupees approximately per month. If you clear those credentials stipulated by the government and the university. And part-time, it is up to you. It will not be under the fellowship. And you can do a pharma or biotech research. And a few students in my lab are also with the MSc background. They are completing their doctoral degree. So getting a doctoral degree in pharmacy, means with the pharmacy subject, that is not an issue for you. It is possible nowadays. And the
Great, great.
specializations from Anna University is offered based on your request, approved by a committee. So if you want to have a specialization mentioned in your certificate, then it is approved by a doctoral committee, then you will be getting a certification also, either based on the postgraduate degree or on the course of research, whatever you have conveyed. So that is possible, I assume. So you can choose, or you can
Thank you, sir.
explore some
Thank
other
you very much, sir. Sir,
universities.
one more part of the same question. Some simple BSc student, BSc in biological science, who are working as a area manager, MR. Is there any online, just like you, why I am asking this question? You shared some certificate course like auditing, like that, which are the not laboratory testing, auditing question, pharmaceutical, good manufacturing course practices. This type of, if they do some this type of courses, whether they may get some more opportunity for earning, right?
Yes.
That is why I asked. And also any scholarship opportunity for those graduates who want to do higher courses, sir? What is the procedure for a scholarship, for instance?
For instance, if it is a regular, means there is some kind of age restriction for some courses for to avail the scholarship, because scholarships are highly competitive nowadays. So if you are eligible with respect to age criteria, then it may be your academic credentials, means the percentage of marks, the reservation. So this is the Indian perspective, and the institute where you are going to learn, and the supervisor and his research or academic credentials, all these things matters. And if it is a private scholarship, then the criteria is also different. Maybe their employees, the armed personnel, the handicapped. So these kind of certain attributes will be the decision making factors. But scholarships are available generally. And if you beyond this limit, or if you are not falling under any of these category, then you may need to seek your support, own support. So that is the only opportunity. Institutes are also nowadays offering scholarship for pursuing students. And the institute fellowship or scholarship is available, but not up to the government level or equivalent to the government level. Maybe definitely it is going to be supportive enough. So you can explore some private institutions or universities for scholarships.
One more question. Thank you very much for enlightening on clearing the doubts, sir. One more question is there. One of our participants asked if you can little bit clarify about what is the difference between B pharmacy and PharmD.
Yes.
B pharmacy and PharmD, any difference, sir?
Yes, definitely there is a difference here. The objective of bringing PharmD into India is to have more clinical practice. The hospital training, the training period itself will be high, means only one complete year is full of training. So therefore, they can be a practicing pharmacist. So they can be called as a doctor of pharmacy. They can use the terminology doctor, prefix the word doctor before them. So they are having a clinical knowledge, very much higher exposure when compared with the B.Pharm student. B.Pharm student, they don't have training as of now. So it is the course of study, means the theory and practical knowledge will be there. But whereas the PharmD students will be having a live training, means real-time training in the hospital or clinical establishment. So that is really helpful for being practicing in the clinical establishments. Your voice is missing, so sorry.
Yes, I'm sorry, your voice is.
Thank you, sir. Thank you very much, sir. Thank you very much. One of the participant, Vipin Kumar Dikshit, has asked one question, sir. Is any pharmaceutical company provide some diploma in sales management? Any company is there? Diploma in sales management. As you mentioned, some of the institutes are there. Certificate course in pharmaceutical sales.
Yes, as of my knowledge, the companies, they are offering only internship. They are not giving a professional certifications for the working professionals. Maybe I invite through this forum, if any of the industry can offer and they can associate with us, means Anna University, to offer some certificate programs and internships and industry institute collaborative efforts in order to refine the curriculum, in order to give more rigorous training, I welcome. But as of now, I don't know anything about this particular thing. So they are giving only internship. They are not certifying.
Sir, I just want to add here, I am associated with one shoot, SIS College, South Indian Institute of Higher Education in Navi Mumbai.
Okay.
And in collaboration with that, there is a course, certificate course in pharmaceutical sales.
Okay.
Certificate course in pharmaceutical sales. I am a part of that course. That is why I know this. It is a 6-month certificate course of pharmaceutical sales. This course is for pharma professional, pharma sales professionals, medical representative, first line managers who want to accelerate their understanding about pharmaceutical sales and their career. So definitely we will connect with Vipin and will give more details on that. I would like to go to Arasan sir now. Arumugam Arasan sir, your views. Thank you very much for watching and coordinating with us to bring Selvamani sir. What is your take home, sir? Arasan sir, today's session?
First of all, thank you, Selomani, for giving the date, Dr. Selomani.
Thank you.
Since you made waste 2 months, but now also worthful because you prepared entirely comprehensive slides and information. Very useful. When we were there in college, we don't know much about this. We used to try for MBA, that's all. Now, so much specialization came in pharma in future. Even touched is artificial intelligence also. In future, there is artificial intelligence AI for the pharma manufacturing and also will come in future. So it's a comprehensive. One more thing he told very clearly, we have to update ourselves. Learning is no ending. Whichever field, even you are student, even after in the industry also, he has told a lot of online courses, scholarship courses, money is not a criteria. If you are working employee also can do a lot of degree in our specialization, in our area, whether production, manufacturing, marketing. We can increase our salary and package everything. Thank you, Selomani. And no wonder under your guidance, I forgot to inform Selomani sir's student, they are now drug inspector and they are working in DCGI. His students are DCGI. I'm very proud of you, really. Keep educating, keep sharing this information, Selomani. Dr. Selomani, I want your date in future also. Any one specific topic in future we can take. Because it will be a social service. It will what we have learned, we have to give back to the society. Yeah. So this really helpful to the public and the forum for the many parents, industry people. This is like a digital library. This video will be there in the record, the YouTube. Any future, any parents want to guidance, any pharma people want to higher degree, you can click this YouTube and you can watch it. Really useful for them. Google Picture, one of the entry told artificial intelligence how it watch small watches, how to detect the heart problem. Anything, one YouTube video I watched in future like that in pharma industry and medical industry going to rule in future.
Definitely.
Thank you, Selomani, for your valuable time and illustrative presentation. And thank you,
thank you very much. Thank you very much.
Thank you very much.
Sir, one more question we have from the participant because everyone is enjoying. Will not take much of your time. We have heard that in USA only pharmacists are able to prescribe, give the prescription. Doctors will only diagnose, and prescriptions are given by pharmacists. What is the truth, sir? Is it right?
Yeah, it's right, exactly. Even our teachers, Dr. Annadurai is now a pharmacist in United States who is prescribing drugs. So we are in touch with our teacher and it's true. But of course, our curriculum doesn't provide the knowledge for diagnosis for our pharmacist. And still we require the pharmacy practice. Still, we are not given full recognition and full training is also required. And there is a political instinct here, the medical and paramedical. So these things is also playing a major factor. Definitely, our education is huge and we need to specialize ourselves in depth in a particular domain. And with this particular aspect, in future, this is going to be happening in India also, I guess. So it should be, it must be. And so that will be the real healthcare because usually nowadays it is healthcare. people have started talking health. It is no more health care. So they want to have an ensuring health. It is not the probability of health. It should be ensured. Health means health should be definite. So for a transformation like this, healthcare to health, so this kind of transformation is also essential. Probably people like you and other forums and government will take initiatives, and this may happen in very soon.
Thank you, sir. Thank you very much. It was a wonderful talking to you, sir. It was a wonderful learning today. And on behalf of Life Pharma Coalition, a global knowledge and networking platform, I thank Dr. P. Selvamani, sir, for his valuable time and enlightening us on various national and international opportunities in pharmaceuticals, and also what is the growth opportunity for those who are connected to pharmaceutical world directly or indirectly. Sir has already shared his credentials. Those who want to know more about the courses, admission procedure, scholarship, they can directly connect to the sir, and sir will definitely help them to get entry. I also thank Mr. Arasan Arumugam for coordinating today's session. It is a wonderful coordination. And all the viewers, thank you very much for all your appreciation. Today's episode, as I told, was 168 episode, and very closely, very nearly, we are going to have another conclave, LPC 175 conclave, which is going to be bigger, brighter, and better. This conclave will be held in Mumbai, and the date is Sunday, 3rd of September 2023. So block your dates. All other details about registration, about the venue details will come to you very shortly. We look forward for you all in person. We request Dr. Salamani also to be there as a panelist, as a speaker in that. I will give you details about that, sir. It is a grand success. Already 4 conclave we have already held to a grand success. This is the 5th one, LPC 175 conclave Mumbai. So we invite each one of you to come, network, and learn and share. Thank you very much. Have a nice day. Thank you very much.
Thank you,
Once
sir.
again,
Thank you,
I
Salamani.
thank all the organizers and the audience for their patient listening. Especially, I mentioned my close friend Arasan for this opportunity, and the moderator and all the LPC team. Thank you once.
Thank you, sir. Thank you very much. Have a nice day.
Thank you. Bye.
Thank you.